This is a second attempt at an odd CTO of the LAD. This is a 52-year-old gentleman with a history of known CAD. He's previously, about 10 years ago, or so ago, had a circumflex stent, and about last year was found to have an occluded LAD as well. So this was essentially a known CTO. Had a failed attempt at a tertiary center and was referred to us for a second opinion. He's been having ongoing angina with exertion, has difficulty working at his job. He's had a nuclear stress test showing extensive ischemia on the anterior wall. He works at a driver, and the reason I brought up that he works with the Department of Transportation is they have very strict guidelines on who can go back to work and who can't, especially if you're driving a truck. He had an attempt initially, took 4 hours. He was told, this can't be opened, just quit, apply for disability, and enjoy the rest of your life. This is the first attempt that was done at the other hospital. So there's a dual angiogram. The collaterals are fairly faint. And they're mostly, in my opinion, were left to left from the circumflex. But you can barely see an LAD, a very tiny LAD ghosting in. He was evaluated by the surgeons at the first institute as well, who thought, well, this is a diffusely diseased LAD. We don't think a Lima bypass is going to work, so they essentially attempted a CTO. This is still, again, the first attempt when we got the film. So they tried to poke at the ostium with an anterograde approach using a Pilot 200. Told it can't be opened. He still has ongoing chest pain. His LV function over the year decreased 50 to 40%. His stress test was repeated again, still showed high degree of ischemia when he came to another cardiologist. So he was referred to us for a second opinion, can something be done? So upon reviewing some of the other angiograms from his past, and we saw this picture. What is this? Where is this coming from? It was sort of, light bulb went off, and then we were like, okay, well, maybe this guy has hope. So this is our dual angiogram. Any thoughts on what this was at this point? Yeah, I think someone's an anomalous LAD. Yeah. So we fortunately had access to his original cath that was done 10 years ago when they did the circumflex stent, and they actually found an anomalous course. So we reviewed that film. We saw that it was taking a benign course, so we talked to him about an option of attempting to treat this. So we tried the real anterograde approach by going through the RCA. We wanted to use a somewhat of a softer wire, not a very aggressive wire, to see how it tracks, because it was a space personally I've never been in before. But unfortunately the fighter wire went fairly smoothly.
What wire is this?
This is a fighter wire. The collateral circulation wasn't great, so we still weren't sure whether are we true lumen or not, but approximately we could tell that we were confident we were true, and then we could get in multiple branches, and after we've exchanged out for a workhorse wire. This is after balloon angioplasty. We did have to end up using a guide liner as well. So, still diffusely diseased, not the best runoff, but we decided to go ahead and stent from the proximal portion of the LAD, place 2 long drug-eluting stents. That's the real LAD. And still somewhat diffusely diseased distally. This is our final angiogram. So he had an anomalous LAD arising from the RCA that was chronically occluded. Critical to review the prior angiograms as far back as you can go before attempting a complicated C2 revascularization. On follow-up, his angina is resolved and he's back to work. All right, thank you very much.